Hello and welcome back. I got him here once again. I think it's finally a habit. What do you think?
I'm live. Do I have a mark up here for my hand in the oar?
Very little. I don't think they can see it.
I just got here. Three surgeries today. Very smooth.
Yeah. So, welcome back. Thank you guys for joining us once again. So I wanted to start today's live going back a little bit to the beginning. I know the first week we did the live, we talked a little bit about your background, your history, your studies, your certifications. But I always find it quite interesting, even though I lived through it. How did you get involved with bariatric surgery, specifically when you were actually a general surgeon and a trauma surgeon?
That's back in history. That's like when I was young and brilliant before I got old and lost all my hair.
You were very impressive, I must say. You really were.
It's actually an accident. And I always tell the story. It was an accident. I was a trauma surgeon and I was an intensivist critical care specialist, and I used to work what's called a level 2 trauma center up in Delray, and I had my general surgery practice here in Hialeah, where I started the practice because I joined another surgeon. I was always from down south. I had never worked in Hialeah, but it's done me good. So I had a group of friends who work for the companies that make the instruments for the surgery, for all sorts of different surgeries. And one Saturday morning, we're supposed to go have breakfast, lunch at South Beach. And they're like, before we die, we have this seminar that we have to staff. Why don't you come by? A bunch of surgeons are going to watch laparoscopic, which is the new way of doing bariatric or weight loss surgery. And I was like, nah, it's not my field. It's boring, whatever. They're like, just come hang out, and then we'll all go have lunch. And I went like, yeah, okay, whatever. I'll go hang out. So I went to this meeting, and it was one moderator, and then there mostly was video live sessions. So the surgery is live, but it's through video from different areas in the country of all the bariatric surgeons. And bariatric surgery at that point was a small, very boutique practice. It hadn't taken off. So I sit there and I start watching some of the bariatric surgeons operate. I'm like, I'm not very impressed. But then one guy comes on and he starts doing this surgery, a gastric bypass, laparoscopically. And I was like, wow, he's amazing. But the thing is, everything that he was doing laparoscopically, I had done before in trauma, in general surgery. So, in other words, he was dissecting around the stomach. I used to do that when I would do what's called Nissen's or reflux surgery. He was connecting the bowel. I used to do that in trauma when we would have to remove a piece of bowel or whatever. So sewing, I always did laparoscopic sewing. I was one of the first people that did it. And I was watching this thing and I was like, man, that is really, really slick surgery. That guy does amazing surgery. So I get up and I tell my friends, okay, I'm leaving now. I'll meet you guys for lunch. And they're like, so what did you think about this surgery? You don't like it, huh? I go, oh, no. I like it. And I'm going to start doing it. And they're like, what? And I'm like, everything that he did, I can do. And I get requests in my practice all the time. Do I do bariatric surgery? And the answer is always no. Well, now the answer is going to be yes. So she was the office manager. I called her and I said, listen, the next patient that calls and says, do I do bariatric surgery? Tell him I'm going to start. Do you want to talk to me? What was her name? Maria?
Oh, we're not going to say the last name because
That's true. HIPAA.
Maria.
My very first patient, she came in. I sat her down and said, listen, I've never done this surgery. I took up a proctorship on how to do it, but I've done all the steps of this surgery many times. But you would be the first person I ever do bariatric surgery on. And she went,
you said, yeah.
Okay, doc.
When do we do it?
Let's do it. Short, run to the end of the story. Within a year, I was doing about 700-800 cases, bariatric cases. And at that point, I was doing so much bariatric surgery that I really didn't have time to do trauma. Because trauma call is you're in the hospital 24 hours waiting for anybody who is injured. And I was like, bariatric surgery is a lot more fun, it's a lot nicer. But people go to me all the time, did you do a fellowship? Like, when I came up, there were no fellowships. No. We came up with fellowships. We were the pioneers. So to have an idea, at that point in South Florida, really South Florida, the 3-county area, Broward, Dade, Monroe, there were 3 bariatric surgeons in the whole Tri-County area. And in Miami-Dade, I was the second bariatric surgeon to do bariatric surgery. So I was literally a pioneer. Now, there's a bunch of bariatric surgeons, different levels, different training. But yeah, I was, for this area, if you're one of the first 4 or 5, I guess you can consider yourself a pioneer, which is why I have the numbers that I have, because I've been doing it for so many years compared to some of the newcomers.
And luckily for your patients and for us, because we have you to ask all our medical questions too, your history in trauma, you kept those certifications.
Right, especially what's called critical care. So to give you guys an idea, if you have surgery and you have a complication, be it your heart, your lungs, infection, whatever, you get very sick. You go to the ICU, the intensive care unit. The person that takes care of you in the ICU in most good modern hospital is an intensivist. It's someone who trained on how to take care of very, very sick people. Their lungs on ventilator machines, their heart on medications, all that stuff. That was my training as a trauma surgeon. That's my certification in critical care. So it doesn't happen often, but when one of my patients gets very sick, basically I go with them to the ICU and I stay there. I've done it actually one time the entire day until they get stable, their lungs, their heart, everything is working to get them to recover. And 99.8% of patients who have a complication, even though they can get very, very sick, recover. But one of the advantages of being an intensivist is I know the patient, I can go take care of my patient. I mean, the hospital has great intensivists, but they're taking care of 10, 20, 30 patients. My patients have one intensivist taking care of them that's there until I'm sure they're out of the woods and on the path to recovery.
So I was 23 years ago and haven't looked back since. So
I mean, it changed everything. My
those
practice,
amazing accidents.
Our practice, yeah. We built this together, and we developed our personal interest in the surgery, the other aspects of it, the programs, and we basically developed it. And as I said, back then there were 2 bariatric surgeons in this county, a total of about 4 in all the 3 counties together.
Yeah. And so speaking of developing, there's one other very, very important thing that you developed. Do you know what I'm talking about?
No. Oh, yeah.
Okay, so I'm talking about the vitamins. To all of our old and existing patients, I know you know about the vitamins, but we have a new label. So this is our new label. Ooh, can you see it? There you go. That's our new label. But the contents inside the bottle are exactly the same. And these vitamins were developed by...
So basically, there were 1 or 2 commercial lines of bariatric vitamins. And why do you need bariatric vitamins? Because you need very high levels of B complex, B1, B6, B12. But you cannot have high levels of fat soluble content. So it's not just like you can take a vitamin and say, take 3 so you get enough of it. Because then the fat soluble, which is A, E, K, will make you toxic. So you gotta have high levels of B complex, which is called water soluble, but the right level of the other one so you don't get toxicity. And on the market, while there were 1 or 2, there weren't a lot of choices. So I sat down, the research, looked up, what is the recommended daily allowance, RDA, in vitamins, in minerals, in certain other things that may be good for weight loss, etc. And I designed a vitamin. And this is the same design that we've used for 20 years. But now they're telling me, you got to put your name on it. You got to put your name on it. Because that's what everything's about nowadays. You got to put your name. So they put my name on it. But yeah, it was my design.
Yes, it's still the same vitamin, and I swear by them. I've been taking them since he first designed them, and I swear by them. So.
I take them too when I remember.
You're better now.
Yeah.
You're finally...
Yeah.
So just like he finally came around to doing these lives, he finally came around to taking supplements. Finally. Now he is actually truly practicing what he preaches.
Yeah, it's like I know the science, but remembering every day to sometimes you forget. But now I got a routine and I'm taking it.
So along the lines of the vitamins, we have a patient that asks que si las vitaminas quitan el hambre. No.
Las vitaminas no quitan el hambre. Las vitaminas no están diseñadas para quitar el hambre. Las vitaminas están diseñadas para darle a la persona las vitaminas que ahora se absorben menos debido a la cirugía. La manga causa que se absorba menos B12. El desvío gástrico causa que se absorba menos B12, menos B1, menos B6. Se necesitan esos suplementos en alta cantidad para que no haya deficiencia. Pero no es para quitar el apetito, es para dar esas vitaminas que ahora antes las absorbíamos de la comida, después de la cirugía bariátrica absorbemos menos de la comida, hay que tomar un suplemento. So vitamins are not appetite suppressants, they're to provide the things that you're absorbing less because of the gastric bypass or the sleeve. B1, B6, B9, B12, the water soluble B complex vitamins.
And in my case, because of my very low calorie diet.
Right, if you're going to go on a restricted calorie diet, in other words, where do we absorb our vitamins and minerals? From our food. And if you have a great variety of food, greens, fruits, etc. Now, when you go to a calorie-restricted diet, hopefully, if you're being smart about it, you're increasing your protein, you're decreasing things like the fruits, things like that. So you may not be getting all the minerals and all the vitamins you need. Boom, that's what a supplement is for. You don't need to drink a 600-calorie smoothie to get your minerals and vitamins when you can take a good supplement.
Okay, question from the audience. After surgery, how soon can you get in the pool or beach?
The classic answer is 6 weeks. Why? Because by then, 99.999% of patients, the wound is truly, truly healed. In the first couple of weeks, you look at your wound and you think it's healed, but it's not. If there's a little scab over, that wound is still not completely healed. Although pool water and ocean water are not supposed to have bacteria, they do. If you get in the water and those bacteria go into your wounds, you're going to come out with a wound infection. Especially the beach, where some of the water can be contaminated and stuff. Potentially going into the water with open wounds is dangerous. So we want to make sure your wounds are truly sealed, which is, we give you that by 6 weeks. However, if by 6 weeks one of your wounds is still open, which happens rarely, but happens, do not go into standing water. Pool, canal, beach.
Very good. Hola, doctor. Me operé hace 3 semanas y tengo hilos blancos. ¿Se caen solos?
Se caen solos. Los hilos blancos, yo lo digo en la oficina. Si ves un hilito blanco, no lo toques, se cae solo. So we use sutures to close the skin, which are called absorbable. Your body absorbs them. Now, in some folks, they don't get absorbed. They get spit out. So you'll see a little string hanging out, a little yellowish drainage. That's the suture melting. Instead of your body absorbing it, it's pushing it out. You don't have to pull on it. You don't have soap and water. It will fall off by itself.
So,
se caen solo, no te preocupes. Agua y jabón.
Agua y jabón. Los hilitos se caen solos. Okay, I lost... no questions, just comment. Okay, I lost 35 pounds the first year, and over the next 2 years, lots of gym and protein, and I've been able to lose 75 pounds. No questions, just comment.
Good. I mean, tools. Surgery, exercise, calorie restriction, tools. Semaglutide, tools. Use as many of the tools as necessary to get to your goal. What should be your goal? Everybody's goal should be a BMI under 30. If you get close to 25, even better. Like yesterday I saw a patient, BMI 25 after 1 year. And I was like, happy. Because if all my patients got to 25, I would be the most amazing surgeon. Mm-hmm. They don't all get there, but that's the goal. But definitely fight hard until you get under 30. Use all the tools. We have them all.
Okay. ¿Cuánto tiempo después de operada para regresar a trabajar si trabajo levantando cosas pesadas?
So, respecto a pesos, después de cirugía, los primeros 3 o 4 días, cualquier peso va a molestar las heridas. Después de como una semana, se pueden levantar 20, 30 libras. Después de un mes, yo permito que levanten lo que ustedes puedan, porque la sincera verdad es que la mayoría de las personas no podemos cargar 100 libras, 150 libras, que es lo que no debes cargar. Pero la mayoría de nosotros, si te dan algo de 100 libras, no lo vas a poder cargar, eso nadie trata. Pero ya después de un mes, puedes cargar 30, 40, 50 libras, con bastante seguridad que no vas a dañar las heridas. So, esa es la restricción. Sin límite, como 2 meses pueden hacer ya de todo. Al mes pueden estar en el gimnasio y haciendo ejercicio.
There you go. Okay. Best decision ever. Lost 110 pounds in 11 months. Way to go.
Congratulations. Way to go. That's what we like to hear. That's what we're here for.
Okay. Can I call the hospital where I got my surgery and request medical records? Yes, of course. We have some records here in the office, but the full history of what happened during the surgery and during your hospital stay will be at the hospital. And every hospital has a medical records department. So you can just call the main number, ask for the medical records department. They're probably going to send you a form to fill out, and you can request your medical records that way. All right. Okay. The main problem I have is that I get sick if I eat too much, and I usually have to have a bathroom nearby because I have to go immediately after eating.
So, I'm not sure what you meant by sick. So, I hear sick, I think either vomiting. If you eat too much, you will vomit. That's how it works. When the pouch is full or when the sleeve is full, if you try to stuff stuff down there, and especially if you try to wash it down, it's not going to fit their muscles, and they contract to push stuff down. But if they're full and they contract, they push stuff up. That's called vomiting. The other sick is if you're eating sugar and you had a gastric bypass, you're going to get colic and diarrhea. People go, I eat a bite of chocolate, I have to run to the bathroom. It usually takes 20-30 minutes when you start getting the colic and the cramps, and then you got to go. You're also going to start feeling bad. So if you're having the thing of, every time I eat, I got to run to the bathroom, you're probably eating poorly. You probably need to adjust your diet. That's what our nutritionists are here for. When people come to the office and we talk about diet advice, remember, I have a limited amount of time. I can give you some boom, boom, boom pearls. Don't eat sweets for breakfast. Don't eat cereals. Eat protein. Increase your protein. If you're having diarrhea, increase your protein. If your sugar is dropping, increase your protein. I don't have time to completely analyze your diet. The nutritionists do. You can do a food diary where they can really analyze at each meal how many calories you're eating, what you're eating, where the problem is. And I also tell people, make a food diary. Every time you get sick, write down, what did I eat? How much did I eat? And then when you create a pattern, you might realize, you know what? Every time I have oatmeal in the morning from this brand, I get the cramps and diarrhea. That's because that oatmeal is pure sugar. So you develop a diary, you figure it out. But if you're eating correctly, if you're eating the right amount, you really, really shouldn't get sick very often at all.
Yeah. So just a little bit on that. The most important thing, anytime that you're dealing with stomach issues and weight gain or loss, whatever it is that your goal is a food diary. It's like my number one thing I harp on. And it's how I got control of my weight. It's how I learned what keeps me full longer. What foods,
You love journaling.
Not that I love it, it's that it helps. It works. It really, really works. I don't do it anymore because now it's just all up in here because I already know what to do.
And you journal for me. I go, what did I eat yesterday?
But it is very important to keep track of what you're eating. You may not realize it, that it may be a certain sauce. It may be a certain condiment. It can be as simple as that. If you realize you're always putting the same condiment on everything and you're not feeling well.
So I have a patient told me, every time I eat fish, I get the cramps and diarrhea. I go, you're eating fish at a French restaurant. He goes, oh my God, how did you know that? You clairvoyant. I'm like, no, the French chefs always make sugary-based sauces because that's what they do. They burn sugar. They make a wonderful, that's why it tastes amazing. It's pure sugar. You're gonna get dumping if you eat those kind of creams on your fish.
And then portion size. Portion size for patients who have had surgery is very difficult. Obviously, prior to surgery, you were eating a certain portion of food in order for you to maintain the weight that you were at. That portion is usually like a plate full of food. You cannot eat a plate full of food. It doesn't matter if it's the healthiest food out there. You cannot. So another tip as you are adjusting to this new lifestyle, and I even do it myself sometimes, is serve yourself on a smaller plate. Serve yourself on a smaller plate. Use a smaller utensils. I've had patients that have bought like a set of baby forks, knives, spoons, and it's incredible because you don't even realize like how big of a spoonful you're eating because you've just been eating this for the last 5 years. So having those tools where you have a smaller plate, smaller utensils. It's going to help you take smaller bites of food, chew that food properly. There's a lot of little nuances. Chewing your food properly, not drinking while you're eating. So all of these things, the nutritionist will go over them with you one-on-one, but these are all good things to remember as you're learning your new stomach. Just like a baby, you are learning to eat again. And for those of you who have had babies or have tried to feed babies, you know that sometimes you give a baby a food and whoop, it came right back up. They were not ready for that food. You are the same way. Your new stomach is a baby. So remember that as you're learning to eat again.
Q-tip.
How to prevent hair loss after surgery.
Hair is protein.
Nails too.
Nails are protein. The first several weeks after bariatric surgery, you're not taking almost any protein. You on clear liquid diets, you're taking in 0 protein. On full liquid diet, you might be taking some protein because of the shakes. If you don't take the shakes, again, you're getting 0 protein. Most of the puree diets are mostly carb loaded, less protein until you're eating more solid meat, etc. So what happens during that time period? Your body does not have enough protein. The first thing your body does when you don't have enough protein is it stops replacing the hair. So hair falls out every day. This is normal. And we replace it, except sometimes you stop replacing it. But that's a different problem. But we replace it. When your body says, I don't have any protein to spare, you stop replacing the hair. Which is why, if you see some of those sad pictures of concentration camps or areas where there's bad malnutrition, starvation, no one has hair. Because when you're protein malnourished, you don't grow hair. You say to your scalp, stop growing hair, I need that protein. How do you prevent it? Take your protein. Once you have enough protein, you grow your hair. In the beginning, you're not eating meat, you're not eating solids, so how do you take your protein? The shakes. The shakes are very important.
And prior to the shakes, the Protein X.
The Protein X,
which is like a syrup.
The syrup,
medicine.
Very concentrated protein, so your body does not go into a protein deficiency. If you don't take them, your hair will stop being replaced. People call it falling out. If you do take them, your hair will not fall out. 6 months, protein supplements, you gotta get enough grams. People go, oh, I took 1 bottle. That's 20, 30 grams. You need about 70 grams to maintain your hair a day. So protein is how you prevent hair loss. Biotin helps too. It's a vitamin that's used in the metabolism for hair growth. So we always tell people, load up on biotin too. But the protein is the key.
And if for whatever reason you cannot tolerate the protein and you do experience some hair loss, the good news is
A, it always grows back. B, we can make it grow back faster in about 4 or 5 months doing the PRP serum injection, the platelet-rich plasma. I've done it myself. It does help.
Yeah, so those patients that then are able to take the right amount of protein, it does grow back. And those patients that need that extra help, we have the PRP to help them with that. So, Dr. Sosa is the best. Changed my life.
Thank you, thank you.
And then this one is a comment from a patient, and it's very long, so
it's long. That's why I want it.
I know.
I don't know what it says, but it's long.
I'll condense it because we're going to be running out of time. It's talking about how last week, those of you that joined us last week, you were speaking about the endoscopic sleeve.
Oh yeah, it doesn't work.
This patient saw 2 doctors prior to seeing you. The first doctor she saw for the gastric sleeve did not tell her any of the things that could happen, did not tell her that that maybe it wasn't permanent. She didn't believe it. She got a second opinion. The second doctor she saw for the same procedure gave her a more true picture of what to expect, and it's not what she wanted. So the third doctor that she saw was you, and now she's had the surgery and she's very happy, and she's so happy that she kept shopping around, but she appreciated you explaining it last week because then it all made sense again.
You have to be informed so you can choose wisely. You may choose to have an endoscopic sleeve because maybe your goal is the wedding in 6 months where you need to lose 20 or 30 pounds and you want something that doesn't have a recovery, doesn't have a long hospital stay, but you got to realize you're choosing something that is short-term, temporary. If that's what you're looking for, it's okay. But if what you're looking for is more permanent, long-term, the endoscopic sleeve is not an option. The endoscopic balloon is not an option because they do not provide. People say, is there a place to use the balloon? Sure. Again, your wedding is in 6 months. You need to lose 30, 40 pounds fast, and you don't want to go through surgery because you're planning a wedding. Get the balloon. You have your wedding. The balloon gets removed, and then you're happy and you regain some of the weight back. You will regain the weight back. It is temporary. So you got to match the surgery, the procedure to your goals. And if you get the wrong thing for the wrong goal, you're just going to fail and regret it.
Thank you, Dr. Sosa. So, do we have a tip of the day?
So we have, yes, so related to exercise. To stay on theme, one thing I don't do that I should do because I should know better. When it comes to working out, and we work out pretty much efficiently, pretty much all the time, several times a week. Ideally, it's 3 to 4 times a week. Sometimes we get 5, sometimes we get 1 or 2, but we try to be very consistent.
Try to do 4.
I don't do cardio. I should do cardio. She does amazing cardio. She does Peloton. She does amazing. The treadmill broke, but we're on the treadmill. She did the treadmill. Now we're replacing it. I hate cardio. I don't do cardio. If I did cardio, my workouts would be much more efficient. I would have much easier time keeping the weight off. And I really should do cardio. I just get this mental block to get on the treadmill. I used to spin, but I haven't effectively done it in years.
I bought him the shoes. Ahí está nuevecito.
I did it twice. It's just a mental block. And I need to get over it because I really need to do cardio. Maybe jumping jacks. Maybe I tried those burpee things. I couldn't get off the floor.
I should have recorded you doing those. That was hot.
But
and then he asked our son, "Hey, do you know how to do a burpee?" Our son looks at him like, "Are you a retard who doesn't know how to do a burpee?"
And he's like, "Dude, I can't." What? Well, anyway, he's a lot younger. And then related to exercise, a tip, very important, and we're now structurally doing. Men love to work out the upper body, arms, and we ignore our legs. Legs are more important metabolically. They're the biggest muscle group. They burn the most calories when they're well developed. They use the most oxygen when you're working out. So, men, please don't ignore your leg workouts. Leg workouts are very important. We tend to avoid them. If you have big, strong legs, you can eat a little more and stay at the same weight because those big muscle groups burn more calories than the smaller muscle groups. So, and that we're now doing legs twice a week. That's how important we think training your legs are, and if you're working out. And by the way, we have a little home gym that we created. Most of your workout, commercial gyms are amazing, but you don't really need all those fancy machines. I mean, online, there's lots and lots of workout regimes, either using small barbells or just using your body. The key is to work out. You don't need the fancy machine. You just need the time and commitment. And if you don't have the machines, go online. There's lots of beautiful programs where using your own body and gravity, you can work out. Or augmenting with some smaller barbells, dumbbells that you can get.
Rubber, like the bands that
they
sell.
You can get relatively inexpensive in a small area. Even the size of a smaller closet, you don't need a full gym to work out.
So along the lines that you were saying, men don't like to work out their legs. Women don't like to work out their arms, their shoulders, their chest, their back, upper body in general. Women tend to like to do legs and the gluteus maximus area a little more. And men like to do the upper body a little more. It is crucial that you get a full body weight workout. It is going to overall change the way you look and change the way you feel.
Like everything in life, balance.
Yes.
You need balance. Your workouts need to be balanced in the muscle groups, in the division between what we call resistance training and cardio.
Yes.
Balance is best.
Yes. You just stole my next line. Balance between resistance and cardio, and then balance between the different muscle groups.
See,
Absolutely.
Great minds think alike. I had it first. She copies me.
Let me tell you something. These minds did not think alike when we first met. I'll tell you that much, okay?
We kind of adjusted to each other.
These minds did not think anything alike. Even, I'll tell you one of the funniest things is when we met, I only drank Coca-Cola.
Oh, I got her to change.
And he only drank Diet Pepsi. Now we both drink Diet Pepsi. I gave in. I changed to his ways.
It's better. It's healthier. It's not healthy, but it's healthier. I don't want people saying I'm saying Coke products are healthy. They're not. but diet is healthier than sugary.
Again, it's what you get used to. We're getting our son used to drinking G2 and Gatorade Zero. So, it's all about what you get used to. So hopefully these tips, tricks, and our own personal habits help. And we're always here to answer your questions. So we'll be here next Wednesday at 12:30, or you can DM us or send us your questions, and we'll be happy to answer them for you as well. So bye. Have a wonderful Wednesday, guys.
Have a great day.